Hi, this is Dr. Tatiana Herzog, board-certified implantologist with over 10 years experience and placed over 3,000 implants. I'm here to talk to you today about dentures. So you can take a look at the history of tooth replacement and you'll see that not much has changed. 100 years ago, people were placing wooden dentures in their mouth with teeth attached to them, and today we're placing plastic dentures with teeth attached to them. They look great and you can smile with them, but it really is just a plastic tray that goes into your mouth, covering the roof of your mouth and covering these important taste buds that you have. Dentures will give a patient only about 10% of their chewing power back. So let's talk about the functionality. We want to be able to chew our food, and more often than not, these denture patients are coming into the practice and saying, I can't even eat salad, I can't grind down the lettuce, I can't eat the foods that I like, I'm starting to lose weight. And so they have these nice looking teeth in their mouth, but they're not functioning for them. So when you have all your teeth and you have 100% chewing power, and then you go to 10% chewing power, then it's a huge difference for the patient, and that lack of functionality really inhibits their life socially and health-wise also. The second thing I want to talk about is discomfort. So this big tray going into your mouth is rubbing up against your lips, rubbing up against the roof of your mouth. If you have a denture, then you know exactly what I'm talking about. So the comfort of having this plastic tray up in your mouth, on the roof of your mouth, or on the bottom jaw as well, it really inhibits speech and function like we spoke about. But most of all, you get sore spots and you get areas where it will rub, and so you have to come in and get adjusted and relined and all of these things, which will become more often as the years go by. So the last thing I want to talk about is the advanced bone loss. When you're wearing a denture, you're not using the bone, and if you don't use it, you lose it. And so as you wear the denture, the bone starts to shrink and the denture will become loose. The form of the plastic is not changing. Your denture is not getting loose on you like, say, a shoe would. But the bone in your jaw is changing, it's getting smaller. And so the denture begins to fall out. And this is where the denture becomes loose from advanced bone loss. Now, how do we avoid all of this? So placing dental implants to stabilize your dentures is a good start, but we want to begin with the end in mind. Eventually, you want to have something that screws onto your jaw. So medicine has advanced so much in these last years that you should also look at implants as an advancement in medicine. And I read somewhere in an article that, having a denture, not supported by implants, but having a traditional denture decreases the lifespan by about 10 years. And this is probably due to the unhealthy habits and depression that some of those patients will feel. So in the end, we'd like to have something that screws into the jaw that is fixed and doesn't move. This is Dr. Herzog. I'm sure you have many questions. You can go ahead and comment and I'll try to respond as best I can. And also you can subscribe to my YouTube channel, which is at Implant Center of Miami. And there I have several videos for you to watch so you can learn more and more about the process. Dr. Tatiana Herzog, Implant Center of Miami.